During the month of November, the home care and hospice community honors the millions of nurses, home care aides, therapists, and social workers who make a remarkable difference for the patients and families they serve. These heroic caregivers play a central role in our healthcare system and in homes across the nation. And joining us this morning is the medical director of hospice and palliative care at the University of Florida in Jacksonville, Dr. Ravindra Maharaj. Welcome. Thank you so much for joining us this morning.
Thanks for having me, and good morning, viewers.
And can you just tell us, what is hospice care?
So hospice care is the care of people who have significant, serious, or life-threatening illness, classically defined as people with estimated life expectancy of 6 months or less.
And what is the difference between palliative care and hospice?
That's a good question. At UF, I work in the palliative care team, and a lot of people think that palliative care is the same as hospice. It's a little different. Palliative care is more upstream, where we help with pain, symptom management, managing the psychological stresses, supporting family, and communicating to make sure that everyone's on the same page. Quite often, we are called to see patients who have significant medical issues going on and who are medically complex.
And what are the benefits of using hospice and palliative care?
Right. So quite often, when we look at the spectrum of life, when a kid is being born and mom is pregnant, there are specialists who look after that extreme in terms of birth and the safety and making sure everything goes well. There hasn't been much emphasis prior to palliative care and hospice about what happens at the other phase of life, the end of life, where patients may have significant issues going on closer towards the end. So things like distress, pain, existential issues. So our specialty is pretty unique in that we help at that extreme at the end of life to make sure that the person is well taken care of and that the family is supported and that a lot of the surprises that can happen are taken care of.
And who is an appropriate candidate for these services?
So good question. So patients who have a medical condition that is expected to get worse and cause decline in their quality of life and lead towards death, those would be good candidates. So good examples would include patients who have COPD, chronic obstructive pulmonary disease, or heart failure, or cancer, or dementia, end-stage renal disease, end-stage liver disease. Those are all conditions that, despite the best of medical care, can decline, can cause decline and lead to someone's death. So having our team involved helps the person to prepare, and not necessarily to accelerate a dying process, but really to be there to support them through the whole ordeal so that it is as comfortable as possible and that everyone is kept in the loop in terms of what's going on.
And this year's theme is, it's about how you live. Can you explain the significance or meaning behind this year's theme?
Right. When I ask patients and families their understanding about palliative care and hospice, the common response I get is that where someone goes to die, and there's that misconception that that kind of service helps to shorten life expectancy. Well, actually, the opposite is true, in that we help everyone live the best quality of life that they can to enjoy every day. So our field is not really to prepare someone for death, but it's rather to make sure that they can find a way to enjoy everything possible in life, to be as pain-free as possible, to look at the important things in life, to foster family connections. So it's really about living every day as if it's your last, because tomorrow is not guaranteed for any of us.
That's so right. Well, thank you so much. Wonderful information. Thank you for joining us this morning.
Thanks for having me.